Good morning, and thank you very much for inviting me to speak at this important conference. My name's Carlin, and I'm Project Coordinator for the Evidence into Action Alcohol Project, EVID-ACTION, which is based at the WHO Regional Office for Europe. It's really important that we engage with civil society organisations and groups such as NordAN to implement the priority areas of the Framework for Action on Alcohol 2022 to 2025, which was agreed by all of the 53 member states of the WHO European region in 2022. As you can see, community action is focus area 6, and bringing communities' voices to tell the stories of alcohol harms and also how to reduce those harms is so vitally important and so much part of the strategy for the WHO office, but also for the EVID-ACTION project specifically. So Evidence into Action Alcohol Project, it's a project that's operating over 30 countries. So that's the 27 EU countries, plus Iceland, Norway and Ukraine over 4 years with a total budget of 10 million euros. And the challenge is huge. In the European Union, of the countries with the highest drinking levels in the world, 7 are in the European Union. Things are not necessarily getting better in many of the countries over recent years, despite the policies that have been implemented in many countries. And specifically in relation to cancer, we are extremely concerned at WHO that many people in the public are unaware of the links between levels of consumption and cancer risks. And just to be clear, that alcohol causes cancer even at low levels of consumption. And in the European Union, according to our data, in 2019, 3 out of 10 deaths from alcohol attributable causes were due to alcohol attributable cancers. So as part of the European Beating Cancer Plan, the EU has co-financed this project, which was launched in December 22 in Copenhagen. And I know that many of your members signed on to the launch, as well as some who were actually present at the launch. And this is a picture of this actually happening. It coincided with the launch of the 3rd edition of Alcohol No Ordinary Commodity, which is a textbook which you'll all be familiar with, which lays out the evidence for the most evidence-based policies, which are the WHO best buys, actions to reduce availability, to reduce marketing, and to reduce affordability, as well as providing evidence for other policies to support implementation of the best buys. So the EVID-ACTION project covers 3 main areas. The first area, as you can see on this slide, relates to alcohol health warnings and increasing our knowledge about kind of the impact of alcohol health warnings and how they can best be implemented. The second area of work covers capacity building, developing health literacy, improving public knowledge and advocacy. And this is one of the areas where we really do want to engage with civil society to take forward the actions. We have developed a number of work streams, including establishing an EU member states focal point network on alcohol, which is going to have its 2nd meeting in Slovenia next week. We're also developing a range of evidence and tools for action, really the focus being to support implementation of the most evidence-based policies. We don't need to reinvent the wheel. We know what works. We just need to support member states in doing it and doing it better. We are also working to establish alcohol action networks, and that includes networks of civil society organisations, networks of people with lived experience, networks of researchers, networks of health and cancer organisations, and really importantly, networks of young people and the youth. The EVID-ACTION Youth Network is going to have its first meeting here in Copenhagen in November this year. We're also developing training packages to support the implementation of policies, and also public information is a really vitally important part of the whole programme. And we will be coming back to you asking for your support to take forward the messages that we will be developing, and to tailor those so that they are going to have the greatest impact in the countries at which you represent, but also in localities, so that we can actually kind of have action working from the strategic level right down to local communities where the harms are really experienced on a day-to-day basis. And the third work package is screening and brief interventions. It's really important that people have access to support when they are beginning to have alcohol problems, so that these problems can be averted, reduced before they become serious, but also so that we can have access for them into some treatment and support for recovery services, and those services as well are there to where they are needed. And the screening and brief interventions part of the programme is going to focus on expanding the delivery of these in primary healthcare settings, in social services settings, and also in workplace settings. So it's a really wide-ranging project. We're really excited to have the opportunity to do it. And as I say, we will be looking to work with you as civil society organisations to take it forward. So these are the expected results. So increased capabilities, increased support for evidence-based policies, the training packages, and strengthened capacity to apply innovative methods in health promotion. This is a specific objective for health warnings. So it's about developing the evidence base. And as part of that, we've been conducting a series of experiments already in online contexts, with almost 20,000 responses, and we will be publishing the findings of this report, looking at attention, knowledge, risk perceptions, and intentions in relation to the impact of cancer warnings, and we'll be in 14 EU countries, and we'll be publishing this report later this year. We've also established a technical advisory group of the best experts in the world to advise us in taking forward this work. We've been working in Ireland in the first phase to look at co-creating messages with different population groups. We've also worked with our collaborating centre in Barcelona to test out how effective or not QR codes might be in terms of providing health information and warning labels. So it's a wide-ranging research agenda that we have here, operating over 4 years. We have already published in relation to the QR codes. This is a meeting of our lovely technical advisory group who are supporting the work. But we will be looking to engage to carry out further studies, including online, but also in real life settings. And the Nordic countries are going to be kind of really supportive for us in terms of taking that work forward. And so this is just giving you a link to the findings of the QR study that I mentioned in Barcelona. The result outlined here is that very, very, very small numbers of people actually use a QR code to access information about alcohol harms. And that should be an indicator for actions going forward, that we need to be looking at how to make health information, warning labels more prominent and more accessible so that people can actually benefit from them. So specific objective 2 is looking at strengthening expertise and sharing experience, building and supporting member states' resilience, and particularly in protecting public health interests in relation to alcohol policies. One of the things that we've heard consistently from our member states is that one of the biggest barriers they experience is interference by the alcohol industry in public health contexts. That's really not acceptable, and the work that we're undertaking as part of this work package will be supporting member states. Again, we hope with civil society help to counteract those activities. It's also really important to look at national and transnational regulatory collaboration, particularly if we look at digital marketing, for example. We need to have transnational activities to address where people are exposed to alcohol marketing in online context, because the internet doesn't necessarily respect national boundaries. And finally here, but really importantly, public communications about alcohol consumption and cancer risks and policy options to reduce these risks is a really vitally important part of the project. So I've just got some examples here. So this was the session that we had for our member states on how to recognise and manage conflicts of interest. So that was one of our first activities, really responding to what the member states were saying was really important in December 2022. These are some of our young researchers who have been meeting over the summer. So these meetings, I'm sure you'll recognise some of these photos. The first meeting, we were delighted, took place in Tallinn and Estonia. And they then went forward and undertook some really, really interesting and important projects. We're also looking beyond this first phase of this work to look at how do we support these researchers who are really interested and really inspired and can really kind of help us shape the future of alcohol policy. How do we support them on a continuing basis through the project? So as I mentioned, we have been in Tallinn. I'm sure that at least some of you will have been involved in some of these activities that took place in May 2023. Really kind of looking at both supporting early career research, supporting member states, providing guidance in relation to what the evidence says about policies, so particularly around health taxes, but also how to implement health taxes. And one of the things that I think is really important for us through the project is that we're bringing all of these together. So we're bringing researchers, we're bringing policymakers together, and we also intend to bring civil society organisations together and young people together as well as part of civil society. So this is some of the pictures that we had from some of those meetings in Tallinn, which were just amazing, and the publications that we launched there. Again, also to say that we were linking to, we weren't starting from nowhere. We were linking to other activities that have been happening in the Baltic regions, but also more broadly across the region. I mentioned the youth network. We're really excited that we've got this great first group of young people who will be meeting in Copenhagen to really set their own agenda to see how young people can really meaningfully influence the impact of this project. They'll be meeting on the 23rd and 24th of November at WHO headquarters of the region in Copenhagen. And yeah, really looking forward to this. I can imagine the noise in the building kind of already, and it's great. So third is I mentioned that we are looking to support the implementation of screening and brief interventions, and what we're undertaking at the moment is a review to see what's out there in terms of availability, and then we'll be looking to set up online resources so that people, wherever they are, can access the tools that can support them in terms of delivering the best evidenced brief interventions in different contexts. So as I mentioned, communications is a really, really important component of the project. And this is our model for our communications plan. We're taking the first draft of our strategic framework to our member states meeting, which is meeting on the 9th and 10th of October in Slovenia. And from there, we really hope that they will engage with us to really kind of support our plans going forward. we want to change the narratives. We want to build narratives about how we can imagine and achieve healthier lives, which don't necessarily need to involve alcohol, but also to break narratives, for example, that to be a normal young person, you have to consume alcohol. That was never the case. It's been a created idea, and it's an idea that we can change. I want to say something about changing culture. We often hear from the alcohol industry and from people saying that you can't change culture. I don't believe that. I very strongly believe that cultures can be changed, and I think that we want to engage with you as civil society organisations in changing this culture, which says that alcohol has to be part of our lives, and that we have to live with the around 1 million deaths in the WHO European region that we have as a result. Every single one of those deaths is a tragedy. Every single one of them is avoidable. And our job at WHO and in partnership with you is to remove those from our horrifying statistics. And we are working with experts to take us forward in relation to this. So this was, I mentioned disrupting narratives. This was an expert workshop that we had with people who are not health experts, but who could kind of help us really think creatively about how to have the greatest impact, including learning some of the lessons from the people who may be opposed to us. It's also been really important to link with the civil society organisations and to celebrate the fantastic work that you're doing. And these are just some examples of some of the meetings that we had in Stockholm in May 2023. We're also working very closely to support the idea of the monopolies, the Nordic monopolies, as being a context where there are opportunities for public health interventions which are made more easy than in other more complex retail situations. So I've been asked to keep it brief, and so I've tried to keep it as brief as possible. I really wish that I could be in the room to be discussing with you, because I know this is what the organisers really want, and I have had the great pleasure to be in your meetings before. Next year, I hope, but certainly we will be having discussions before then. Not least as part of European Awareness Week on alcohol-related harm, where we're working very closely with Eurocare as a partner to develop joint activities, and really looking forward to that. Thank you so much for your support, and please let us know if we can support you in your activities. Thank you.